Introducing NASM 1, NASM's ultimate membership program. Unlock access to everything your fitness career needs to succeed. Unlimited CEUs, free courses, access to our premium app, and exclusive discounts, all for $35 a month. NASM 1 is best-in-class tools, cutting-edge certifications, confidence in your craft, and everything you do as a personal trainer made easy, so we can achieve our greatest goals together as one.
You're listening to the Peak Physique Podcast with Andre Adams on the NASM Podcast Network.
Hey guys, welcome back to the Peak Physique Podcast. I'm your host, Andre Adams, NASM Master Trainer and IFBB Olympian athlete. Today, we've got a very special treat for you guys. On this episode, we're going to be talking about how natural medicine can help improve the physique athlete's performance and longevity. On this episode, I'm going to dive into things like nutraceuticals and how some of those natural medicine therapies can be utilized to help enhance not only bodybuilding performance, but also longevity. And today I'm joined by a very special guest, good friend of mine, Dr. Indy Vasquez, Doctor of Natural Medicine. Indy, welcome to the show.
Hello, thanks for having me.
Absolutely. You know, you and I have been wanting to connect for some time. So many good things going on. You know, we've got True Metabolics, right? That's probably initially how we had that discussion. Tell us, our audience, about True Metabolics, your involvement there, and then also, what you do at your practice specifically.
Sure. So True Metabolics is my supplement company. I'm the formulator. I have wonderful business partners, of course, but it is designed specifically for the athlete in mind. So a lot of what I do in my practice is enhance athletic performance in the top performing athlete. We want to keep them nice and safe. So we'll talk a lot about that today.
Yeah, absolutely. You know, some of the things I definitely want to make sure we hit on for the audience will be some of the latest and greatest in testing and assessments. I know you've got some really, state-of-the-art things that you're doing, things that I've been wanting to do for quite some time. So you and I will definitely connect as we, move through subsequent weeks here, but also key health indicators. It's always good to see what things that you might look for specific to someone like a physique athlete like myself. Bioresonance scans, that one really stood out to me. I think there's some really cool things we can look for, but then everything else, right? When we think about holistic health and wellness, immune and gut health, anti-aging, detoxification, these are all areas that I think we can leverage your expertise and services as a resource to, athletes.
Yes.
Right. Yeah. So I'm excited to definitely dig into all that. One thing that I'll give an overview for anyone that's tuning in. When we think about an athlete and what we have to put our bodies through to step on a bodybuilding stage, it's intense, right? I mean, there's everything from intense training where we're breaking down a lot of muscle tissue, so trauma or exercise-induced muscle damage. We've got a lot of metabolic stress happening in the body, and all of these things can put a lot of extra stress and strain on different systems in the body, right? The liver, kidney, adrenal glands, all the way through. So those are definitely areas that we can optimize an athlete's performance and overall health or well-being. And, the other pink elephant in the room, right? Whether we're a natural athlete or we're an enhanced athlete, can also certainly make a difference in, how much we should prioritize our detoxification and health. So, I think one thing that's not talked about enough are athletes that are enhanced, right? So if we're using exogenous hormones and cutting agents, SARMs and SERMs, peptides, we have to be a bit more cautious and really pay attention to these key health indicators to stay healthy. So let's maybe start there, right? We've got that scenario. We've got athletes who are putting our bodies through all this stress. When you start with an athlete that reaches out for help, walk us through some of the initial assessments, kind of health history that you would go through with a client.
Yes. So I always start with a screening called hair tissue mineral analysis. That's one of the required screenings that I need to make sure that I understand molecularly what's happening to your system. I feel like it's even more important than blood labs, right? Because if blood labs come back and they show that your thyroid's underactive or your hormones are low, I'm still going to wonder what minerals are driving down this function. So as athletes, we're very, very hard on our bodies and we burn very hot. So first and foremost, we have to make sure that we're screening minerals.
Yeah, I was going to ask you about some of the
Mhm.
differences between traditional blood work, which, over the last decade or so, it's finally catching on where people are like, all right, I should start paying attention to my blood work. And I think for the average gym goer, the blood work is probably like, it looks like they're looking at hieroglyphics. They don't understand it.
Mhm.
Um, you know, I was fortunate enough to work very closely with some medical partners like Titan Medical Center at the time. And one of my local, excuse me, partners here, Drew Velasco. So
Mhm.
I'm familiar from a physique coach and athlete standpoint. You're going to be looking at things through a completely different lens, right?
Yes.
Looking at mineral, maybe toxicities,
Right.
deficiencies, and then looking to optimize from there. And I think later in this episode, I'd love to even go through like a case example of
Mhm.
maybe a physique athlete and what kind of findings you discover, and then what those remediation or those treatment plans might look like.
Sure. I have a couple I can talk about.
Yeah, for sure. So you've got the that analysis. Are there any others that you traditionally lead with, or if something is an outlier or you get a red flag, then you go a little deeper with additional testing?
Yes, I also like, are you familiar with Dutch testing?
No, that's actually new to me.
Dutch, the Dutch, I like the Dutch cortisol awakening response or complete. So that's urine metabolite, which is, I think, a better understanding over a course of time what's happening to your system. I'll do some blood labs. I like to check inflammation markers, like your omega-3/6 ratio, your apolipoproteins, high sensitivity C-reactive proteins. Like I want to see, does inflammation drive insulin resistance in the athlete? What kind of effect of that is it happening in the heart, that sort of thing. So I kind of go by hair tissue mineral analysis, Dutch testing, and then blood labs. Blood
Okay,
labs are
so
kind
there's
of at the bottom of
different layers, right? So some of those biomarkers might
Mhm.
lead you into additional testing. And I love that you mention insulin resistance or insulin sensitivity, because that's one that, whether you're a natural athlete or not, I think is very important, right? When we're thinking about peaking out a physique, we definitely want to have very good insulin sensitivity, right? Where your body's not resistant and you're able to push some of that glucose and those carbohydrates into the muscles to be stored as glycogen.
Mhm.
If you're a bodybuilding athlete, the goal is to get on stage as full and tight as possible. So I think that's definitely like glucose optimization
Mhm.
is always top of mind. And, again, because of all the different drug interactions and
Mhm.
just people's genetics, right? There's all sorts of different things that could be going on there. So definitely want to hear more about that and how that could be potentially leveraged. Do you frequently see athletes that maybe are using insulin or using something that changes like the hemoglobin A1C, right? So like let's
Mhm.
take like the GLP-1s, like an Ozempic or something, and what impacts do you frequently see on insulin resistance and these type of things?
So when I can almost guarantee that nearly all athletes that I work with are insulin resistant to some degree. Um, when we're on Ozempic and things of that nature, it's kind of it can be helpful, but when you are strategically supplementing with proper minerals, berberine, that sort of thing, you get to the root cause of the insulin resistance, right? So the Ozempic can be helpful. Most of the time, I've noticed a lot of side effects come out away from with digestive issues, that sort of thing.
Right.
So for me, it's like, why don't we treat the root cause? And as you already know, each time you go through a weight loss cycle or a recomp, it's harder and harder to lose weight because of how the immune system is essentially damaged through this weight loss cycle. So if
Hmm.
we can address that, you won't need the Ozempic, you won't need these other pharmaceuticals that could hurt your digestive system in the long term.
Right. And I love that approach, right? We're treating the root cause instead of
Mhm.
treating all the symptoms. And I think that's like all of those things that we just mentioned are super important for the physique athlete, whether it's exogenous insulin supplementation, metformin, any of the semaglutide type therapies.
Mhm.
All those things can change the way that our body reacts. And then even for natural athletes, or just from a dieting and nutrition standpoint, when we talk about things like, carb loading, carb cycling, and then, even myself, right? I had to go from an IFBB Pro men's physique competitor, roughly 185 to 190 pounds on stage, to 245 pounds at my heaviest when I changed divisions, right? I went up a division to classic physique. And for sure, if you're slamming 500, 600 grams of carbs a day for 6 months, you're going to have some insulin resistance
Right.
over time, right? Your body, you're going to start to fatigue those cells and the receptors and all that stuff. So I think that'll be one area I would highly recommend any of you athletes get testing done, check for your insulin sensitivity and resistance. And to your point, right, berberine, I look at like products like, a GDA type product that's going to have
Mhm.
500 milligrams of berberine or so, and pair that with your high carb meals. You could even do that
Right.
with dinner, right? If you want to regulate your glucose overnight. All these things are more natural ways to keep your body functioning and firing appropriately.
Right, which doesn't, I'm not saying, using these pharmaceuticals is bad, but if you're going to marry it with things that are also going to keep you very safe and will reduce the weight gain after coming off of the pharmaceutical.
Exactly. Yep. So we're, attacking both sides of that, right? Where you're, maybe there's a purpose and strategically for that outcome you're trying to achieve with the physique, you need those pharmaceuticals, but you can still look at it from a holistic standpoint and make sure that your body's good and healthy and you're providing the right
Right.
nutrients.
That's what I'm all
Good.
about.
Exactly. We're on the same page. Guys, if you're just joining us, welcome back. This is the Peak Physique Podcast. I'm your host, Andre Adams, and I have a very special guest in the house today. This is Dr. Indy Vasquez, and we're talking about natural medicine and how that can be leveraged for the physique athlete. We just got done talking about some key health indicators, insulin resistance, and we touched lightly on some of the testing and assessments. I want to go a little bit deeper on that. Let's
Mhm.
think about a case example with some bioresonance scans, and think about how, what kind of maybe flags or indicators do you commonly see, and then what would a treatment plan look like, right? Maybe that treatment plan is to improve detoxification or rejuvenation so they
Mhm.
look better, feel better, or maybe it's to improve performance.
Mhm.
Walk us through maybe a case example of what you have seen in the past.
Sure. So I commonly work with female athletes on hormone replacement therapy. So we'll just take an athlete, talk about her real quick. She sends me her sample. I put it through the bioresonance scanner. It's called a nonlinear bioresonance scanner, and I can see that her digestive system has intestinal parasites. I can see that there's a lot of inflammation. I could see in her scan that her liver is congested and that her central nervous system is in fight or flight. So I marry that with the results of the hair tissue mineral analysis, where we say, okay, we clearly need to do a digestive healing program. We need to also support those low adrenals, which will cause, poor um, poor digestion in general if you have adrenal dysregulation. And we supplement properly, not only with the gut healing protocol, but the mineral protocol. She does that for 6 months, and she no longer needs her hormone replacement therapy. And she actually has to come off of her prescribed thyroid medication because we have healed the dysregulation in the nervous system that was driving those, what seems to be the root cause, but those are still superficial issues, right? The
Yeah.
root cause was adrenal dysregulation and insulin resistance and a digestive imbalance.
Wow, I think that's phenomenal. That's gold when you're talking about an athlete or even just a lifestyle client, right? If we can treat the root causes, and you think about things like adrenal fatigue, definitely I would say 100% of athletes on this planet that train for something like bodybuilding, right? You're
Uh-huh.
going to have some level of adrenal fatigue or
Mhm.
metabolic damage after so many years of contest prep. So addressing like those underlying issues, definitely a lot of stress and strain on the thyroid, right?
Mhm.
And again, sometimes there's things like T3 and T4 that are exogenously supplemented, which can suppress your your body's ability to naturally produce these hormones. Wow. I mean, this is something that I get excited about as both an athlete and a coach, because it's such a value add for anyone that's training for a competition, or maybe you're done training for competitions and you just want to feel better, right? You
Right.
want to get off these medications and treat those root causes that are, giving you these chronic conditions. So
Yeah, and that's a big thing that I talk about with everybody, especially my athletes, is that there is life after sport, right? You can be as aggressive in your recovery and protecting your system as you are in your sport, right?
mhm,
So we have to start now. And the earlier you start in your bodybuilding career, the better you're going to do in your bodybuilding career, the longer you could stay in
yeah.
the career because you're optimized the entire time.
Exactly. The hormones, that's one that really I think is fascinating to me, because
Hmm.
so many people on this planet, when we think about, especially if we're talking like 30 and up, but even young athletes that have used exogenous hormones and maybe threw their body out of whack, right? And you've got a lot of different compensations and things happening in the body. But especially important for older athletes, I think, whether you're actively competing, you're post cycle, or you're completely done, if you can optimize hormones through something like natural medicine, that's gold.
Hmm.
Most people just accept that, hey, you know what, I'm at that age, I need TRT or HRT, and they don't think twice about it, right? They jump on a protocol, and that's for life, right? You have
Yeah,
to,
or even their physician tells
yeah,
them, "Well, you're getting older. What do you expect? You're going to be sleepy."
right.
No,
Exactly.
hold on a second.
Right. And let's touch on that. You brought up a good point.
Hmm.
I think chronic fatigue and low energy is probably the number one complaint, male or female,
Hmm.
that, pretty much every person on this planet complains about. I wish I had more energy, right?
Hmm.
Even after getting a full night's sleep, right? They don't wake up fully recovered or refreshed. And all those symptoms that you just discussed, from hormone imbalances, from adrenal fatigue, high cortisol and stress hormone levels, all those things can be contributors. But other things that play into that same discussion would be concentration and focus, right? A lot of people struggle with that, whether they're at their day job or they're just, trying to be a little bit more active in their daily quality of
Hmm.
life with their family. Libido, all these things are impacted by hormones. So if you can address those underlying causes,
Right.
I think that's gold.
Yeah, I mean, you are basically hormones, neurotransmitters, vitamins, and minerals.
Right.
If we get down to the basic of what we are, focus on those things. There should, I've had patients tell me they're 26 years old and their doctor tells them, well, you're a mom or you're getting older. What do you expect? You're going to be tired, and it's just. Um, it's frustrating to me because you should feel good. 87 years old, you should be feeling
Exactly.
good.
I love it. I love it. So definitely stay on top of the testing, stay on
Hmm.
top of the hormones, and dig a little deeper, right? Don't just
Right.
immediately jump to medications if we can treat these things naturally first and foremost.
Hmm. Right.
I love it. So, Dr. Indy, how would you describe, when we think about things like immune function, we think about gut health, how can we leverage those things, and how do they impact the physique athlete's body, right?
Hmm.
I know that you do a lot of different things. We touched lightly on some of the testing for gut health. How does some of the testing that you do compare to things like GI mapping? I guess how are they different, and how can we leverage those things for better performance with our athletes?
Yeah, so I don't love GI mapping for the reason that it has been shown to be kind of unreliable. So I don't know how people are going to feel about me saying this, but food sensitivity testing and GI mapping, those things can be costly and they can be inaccurate. So the edge that we have is when we do the bioresonance scan, this is your energy. This is your information. It's very, very accurate. And when you send me your sample, I would love to show you exactly what I'm talking about because you're going to be blown away. It
Yep.
shows things that it's more sensitive than blood labs. I have found some serious issues. I've had to tell patients like you're telling me that the possibility of thyroid cancer is high. We need to go get an ultrasound done. And sure enough, you go and you confirm that there is a thyroid cancer on the left side of your thyroid, which the scan has told me.
Mm-hmm.
So it's very, very sensitive. And the reason why I leverage it so heavily with my athletes is because we want to optimize every function, every organ, every cell in the system so that you can be the best that you possibly can be in your sport, right? So leveraging the electromagnetic component of your body is underutilized. It's just very, very important. You are more energy than you are physical, right?
Mm-hmm.
And when we get to that part of medicine and marry it with clinical nutrition therapy and herbs and whatever else that we like to bring in, you have a complete picture of what's going on with the system, which is what everybody needs, especially athletes, high performing athletes.
Absolutely. When we think about, recovery for an athlete, if I think about gut health in general, right? If I'm inflamed, chronically having issues in the stomach, or digestion, right? It can be a nuisance for two things, right? One, you might just be constantly uncomfortable, but for two, you might not be able to uptake the proper nutrients and
Right.
follow the meal plan, right? And so you're not really getting 100% of the benefit out of that. And that can really throw off a prep. I mean, I've seen really high caliber athletes go through an entire prep and then suddenly 2 to 3 weeks out from a
Yes.
contest, they start having all kind of dietary issues, digestion issues, and they're chronically bloated and they spoil their show, right?
Mm-hmm.
So again, if we can definitely optimize the gut health and the nutrition,
Mm-hmm.
always going to help increase performance. And then just, your mental space, right? If you feel good, you're going to,
Right.
it's just natural. You're going to perform better when you feel better.
Right. And when we're in prep, we're eating a lot of the same foods, right? And that can lead to gut microbiome imbalance. That can lead to an overabundance of histamine in the digestive system, which causes a lot of gas and bloat and discomfort. So really leveraging nutrition therapy in prep and keeping things diversified. I see that a lot, like you said, at the end of prep, we see a lot of constipation. Um, all ends of the spectrum, a lot of issues that
Hmm.
can be managed honestly through mineral balancing. A lot of it's potassium deficiency.
Hmm. No, that's an excellent point. And if we think about that throughout the course of a prep, Dr. Indy, how frequently would you recommend the typical athlete get tested? So let's say it's somebody who maybe doesn't have necessarily chronic issues, but they want to be proactive and make sure that they are more of like preventative medicine. How frequently throughout the year would you recommend getting tested?
For hair tissue mineral
Yeah,
assessment.
exactly.
So
Yep.
during prep, I test more aggressively. So I do a screening every 3 months to make sure that as you're leaning out and as the stress, builds, the system is recovering and staying ahead of that fight or flight response. And then we do another mineral assessment 2 to 3 weeks post show to make sure that you're on the proper regimen to recover. And then from there, if we're doing a long prep or we're in an improvement season, I'll do every 4 to 5 months, we'll rescreen the mineral assessment.
Excellent. And our bodies do change over time. So that's the importance of, constantly monitoring it
Mm-hmm.
during the prep. You're able to maybe make some adjustments up or down,
Mm-hmm.
modify your plan so that your body can perform better. But you guys heard it here, right? Every 12 weeks, plus or minus, if you've got something acute or chronic going on, maybe you need additional testing somewhere in between there, but that's a good place to start.
Mm-hmm.
Guys, if you're just joining us, this is the Peak Physique Podcast. I'm your host, Andre Adams, and I'm joined by a very special guest, Dr. Indy Vasquez, Doctor of Natural Medicine. We have so many good things that we are dropping today. This episode is definitely a gem, Indy. We've got, I know our viewers are going to love it because, we try to constantly stay on the cutting edge of what things can we test for? How can we get smarter about things like contest prep, or even just people that are going through transformations of their own and want to look and feel better. And I think a lot of the things we're talking about today are essential, right? I wish that this stuff was more widely available 10, 15 years ago when I was like really, really competing heavy. I feel like there's so many other things I could have done, but moving forward, definitely want to integrate this as part of not only my own prep, but all of the different athletes that we work with as
Right.
well.
Just makes you a better coach.
It does. And, for you, here's the interesting thing about your position, my position as a contest prep coach. It's all about data, right?
Hmm.
And when we work with hundreds and hundreds and hundreds of patients or athletes, you start to see some common denominators. You start to see things that
Hmm.
constantly show up and tend to be outliers. And so it helps us, get a little bit smarter about how we approach a treatment plan. And, if you are a coach out there, highly recommend reaching out to Dr. Indy or a medical professional in your area and partner up, right? These are ways that you can provide a better service as a trainer or a coach to your clients and your patients. And Dr. Indy, any recommendations on this is probably the last thing we want to leave the audience with today, but when we think about detoxification, so let's go post cycle, right? Post
Hmm.
show, everyone's kind of deloading from two things, right? The nutrition and supplementation, and they're deloading from the intense training and 7 days of cardio. I hear horror stories, 2 hours a day, 7 days a week. I've personally
Trauma,
never
don't want to
had
go
to do
back to
that
the
much.
gym.
Yes. So as they're deloading from all that post
Mhm.
show, what things would you recommend from a natural medicine perspective for detoxification and rejuvenation therapies
Mhm.
for an athlete?
So I always start with nutrition therapy. So I will recommend a 7-day commensal bacteria push. And this is because when we are very lean, um, Akkermansia and bifidobacterium strains are depleted in the digestive system, and that can cause all kinds of issues. So we do a 7-day commensal bacteria push using very specific foods. I really advocate infrared sauna blankets, sauna therapy. I love breath work. I love implementing meditation, that sort of thing. I try and give things to patients that it doesn't require you swallowing pills, right? We
Mhm.
want to balance the central nervous system as quickly as possible, and the easiest ways to do that is breathe, DMT alkaline breath work or whatever kind of style you like. And then a nice sauna, not a crazy sauna where you're sweating and, 20 minutes, but you're doing a 10, 15-minute sauna. And then you're hitting a cold shower right after. So we want to get you back into that parasympathetic response.
Right. So almost a bit of contrast therapy, right? Infrared
Yes.
sauna, you're pushing out some of those toxins in the body. And
Hmm.
like you said, if you can then hit that with some contrast, maybe a cold plunge or a cold shower, you definitely can shock the body into its own response and help
Yes.
rejuvenate your system a little bit faster.
Right. And then always watching the entire prep, especially after you come off stage, is, what is your heart rate variability? Where's your deep sleep? Are you
Hmm.
getting the proper recovery while you're resting? So all of those need to be looked at.
Yeah, it's funny you mention that. I'm actually wearing my Garmin watch right now, and this one it's a wearable, right? Kind of like the Aura
Hmm.
rings and different type of technologies, and I love it. You can track your sleep, and
Hmm.
I was fascinated. Again, you can probably tell I get fascinated about anything that helps improve performance.
Right.
And I've always wondered why sometimes I can get 8 hours of sleep, and I still wake up not feeling refreshed. Well,
Hmm.
once you start tracking your stages of REM, minutes or hours of deep sleep. I'm ashamed to say minutes.
Okay. What's your HRV?
Right, exactly. So you can start
You
piecing
just
away at
tell me.
it. And you can start piecing away. What I love too is like
Mhm.
if you are an athlete, the wearables can get a little expensive. Sometimes you have to have a subscription for your
Mhm.
data, but if you can track that over a period of time, that's something that athletes can actually share with us, right? And
Mhm.
we can take a look at their sleep, their recovery score. And what I've noticed personally is like even my resting heart rate tends to be a bit higher if I had a very stressful day
Mhm.
or I had a really hard leg day like today.
Mhm.
It can definitely impact your recovery and HRV and all these other scores that you can extract from these wearable devices.
Right. And then it better helps the practitioner or your coach. If you tend to have a higher heart rate after a stressful day, you'd want to take holy basil before bed to calm your central nervous system down, slow your heart rate down. You'd want, to do all kinds of really neat things. The more
Mhm.
data you have, I love data. All my patients know, please text me, blow me up. I want to know all the things about you so that we can be very strategic about how we hit your healing protocol.
Absolutely. The more data, the better, right? We're
Yes.
evidence-based. That's why you and I click, right? In my past life, I was a mechanical engineer for many years. And so my mind is very analytic, and I just love it. I find it fascinating because every person it's a unique puzzle, right? And
Mhm,
it's something that you work together with the patient to come up with a care plan that fits their goals and outcomes. And you
mhm.
hopefully can teach them something about their body in the meantime. A few other therapies that I do like during the on season would be actually the true adrenal, true liver, and
Oh,
true
yeah.
kidney, right? Very, very potent, high end, right? We're going to get those nutraceuticals into the body. And that's more of like your maintenance, right? As you're putting those stress and strain on your body throughout contest prep, you can help keep your body flushed out and keep your adrenal system from fatiguing, hopefully, right? That's always the goal.
Mhm.
So those are some therapies that I've definitely enjoyed integrating into a lot of our care plans for
Thank you.
our athletes that are actively prepping as well.
Yeah, and the way I formulated that is when you look on the label, you can tell that there is enough ingredient in that product to do something nice to your body. Because a lot of
Mhm.
times these products have, 25 milligrams here, a little hit there, a little, 100 milligrams over here, and it just doesn't do anything for the high functioning athlete, the person running hot. So I really love the adrenal product. Have you tried it yourself? The adrenal?
I have, and definitely have noticed, better energy,
Good.
waking up more refreshed as well. More sensitivity to things like my cup of coffee in the morning, right? So
Good.
I'm very in tune with my body from prepping for so many years. I can always tell when I'm starting to get a little bit of that adrenal fatigue. And
Mhm.
same thing, I have a constant feedback loop with all of our athletes. So in their check-ins, when they reach out and they're like, hey, yeah, I'm getting my 7 to 8 hours of sleep, but I just feel so exhausted every morning and I wake up. My recovery is poor. I'm drinking servings of caffeine, right? I'm having 600 to 800 milligrams of caffeine a day, way too
Mhm.
much. And right away, I can already start to get a feel for the ones that maybe have a little bit of adrenal fatigue happening.
Mhm.
And sometimes it's just, stressful work or maybe it's home life, whatever it might be, where they've got chronically high levels of stress and cortisol that are just fatiguing the body over time.
Mhm. Yeah. And even our lifts are high CNS, so
Yeah.
stress is coming everywhere, so all the time. So put a buffer around your nervous system, everybody. If you take a message away from this, put a buffer around your nervous system, and you can get hit. You can run 3 companies and have kids and a family, and it just won't hit you as hard. You'll still be able to lift well. You'll be able to recomp the way you're supposed to by creating a buffer around the nervous system.
Exactly. Right. We're constantly pouring water out of that tank into all these
Yes.
different facets. We got to refill the tank.
Right. And then when we're resting, we feel guilty about resting. So we're telling
Yep.
ourselves that we should be doing something, like it never stops.
Oh, believe me, if I try to go to bed early, I'm already thinking about how I'm going to squat 600 pounds tomorrow and how many
There you
reps I
go.
should get with that. So I hear you. Well,
Oh,
Dr. Indy, it's been a pleasure to chop it up. I think we're going to have another follow-up episode
sure.
once I get my samples over to you. I'm curious to learn even more about my body and maybe share those results with our audience.
Sure.
But in the meantime, too, I want to make sure people can access you. Tell them where they can find you at online and also, in person at your clinic.
Sure. So I am in Broomfield, Colorado. It's in Denver, but I service everybody around the world. Really, I have people all over the place. So no matter where you are, I can help. And you can find me on Instagram. Reach out to me there. DM at dr.indigovasquez is my handle.
Perfect. And if you can't find her, you can probably just go to mine and search her and you'll find her. We're going to definitely be doing some cool things together. If you guys want a really good 1-2 punch, pair up Team Adams Prep and Dr. Indy, and you're going to have some magic happen. So I'm
I'm
excited to learn
excited.
even more and continue doing some really cool stuff together, Indy.
Yeah, thank you so much. This has been awesome.
Excellent. Guys, for you watching, if you enjoyed this episode and if you've got value out of it, please don't hesitate to share with a friend and spread the word, right? Peak Physique Podcast, we're your one-stop shop and your resource for everything contest prep, physique, and bodybuilding related. Until next time, guys, we are signing off.